The $2.5 billion health deal from the US to Kenya sounds like a lifesaver, but it comes with strings that could hand over your personal health data. Welcome to Politicos 254. Here we talk about law, power, and politics. Now, today we are diving deep into one of the biggest controversies hitting Kenya right now, and that is the Kenya-US Health Cooperation Framework, which was signed on December 4th, 2025. Now, on the surface, it's a massive $2.5 billion grant to Kenya over a period of 5 years to fight HIV, TB, malaria, and more. Now, days after the deal was signed by Prime CS Musalia Mudavadi and the Secretary of State Marco Rubio in Washington, D.C., the High Court of Kenya slapped an interim suspension on the data sharing parts of the deal over major privacy fears. So it begs the question, is this genuine help for Kenya's struggling health system, or is it a strategic move by the US with strings attached? In this video, I'll be breaking it down in detail, the background of the US deal, the US motivations, pros and cons, and so on and so forth. So let's get down to business. To understand this deal, we have to go back to early 2025. The Trump administration straight up dismantled USAID, the agency that handled most UN foreign aid for decades, including huge health programs like the US President's Emergency Plan for AIDS Relief, a government initiative to combat HIV globally. They called it inefficient and wasteful, with too much money lost to NGOs and the World Health Organization. So, in September 2025, they launched the America First Global Health Strategy, which entails direct government-to-government deals. Basically, there's no more routing of billions through NGOs or the United Nations. This has been replaced with direct bilateral agreements between the United States and the countries receiving aid. The goal is to have dozens of these pacts worldwide. So this shift has disrupted global health funding, but the US says that it's about accountability and making America safer from pandemics. So what exactly is in this framework? It's a 5-year memorandum of understanding, whereby the US will commit up to $2.5 billion in grants and technical help to Kenya for a period of 5 years. Kenya, according to the deal, must pledge to boost its own health spending by $850 million. Now, priorities include HIV and AIDS, TB, malaria, maternal and child health, polio eradication, and beefing up disease surveillance and outbreak response. Now, Kenya transmitting its health data is an integral part of the deal, with pathogen samples shared by Kenya upon request by the US. Pathogen samples refer to biological materials such as blood, saliva, tissue, or environmental swabs, collected from a host or environment that contain disease-causing microorganisms, such as viruses, bacteria, fungi, or parasites. Now, these are used for identifying, studying, and diagnosing infections through lab tests. Now, the transmission of this biological data is supposed to comply with Kenya's Data Protection Act. According to the data sharing agreement, Kenya shall not provide individual level health data or personally identifiable information to the US government. Furthermore, the deal requires Kenya to provide the US government with relevant data derived from its health programs for a period of 7 years. Now, after Kenya signed this deal, similar deals quickly followed, with Rwanda, Uganda, Lesotho, and Liberia signing. In fact, according to US Secretary of State Marco Rubio, there are 30 to 40 similar agreements to be signed by African countries, and there are also reports of about 50 agreements to be signed. So, why is the US giving African countries grants? Well, it's not about pure charity, obviously. According to the America First Global Health Strategy, the main purpose of this program is to, and I quote from the document, keep the shores of America safe by monitoring disease outbreaks in African countries and stopping them before they get to American shores, end quote. Now, apparently, this is to be done through a global surveillance system that can detect an outbreak within 7 days. The US government will prioritize mobilizing a response to every outbreak that threatens the US within 72 hours of detection. The second pillar of the strategy, according to the AMFAS document, is to leverage US global health leadership to compete with China. Another goal, according to the document, is to streamline and maintain a robust monitoring system. So basically, they'll be monitoring service delivery, including that of individuals on ART treatment, individuals tested and treated for malaria, and those treated with TB. They'll also be monitoring epidemic control with a focus on HIV, malaria, TB, and polio cases, and also deaths by geography and major demographic categories. Supply chains as well will be monitored, apparently with mechanisms to prevent and detect fraud, waste, and abuse in supply chain delivery systems. Local government investment in the program is also going to be tracked and monitored. Now, finally, the objective is to open the doors to US companies to do business. Now, according to the AMFAS document, the US will use foreign assistance funds to procure supplies from US-based companies like Abbott and Hologic. In fact, on September 4th, 2025, the Trump administration announced a new initiative with the American company Gilead Sciences to roll out a 6-month injectable for HIV prevention. Now, US health foreign assistance programs also heavily utilize American logistics companies to transport commodities internationally. So, based on this, we can conclude that the motivations behind this deal are purely based on American interests. Health data is a strategic national asset according to the Kenya Digital Health Act of 2023. Just days after signing, Kenya's High Court suspended the data sharing provisions in the deal. It was petitioned by the Consumers Federation of Kenya, or COFEC, who argued that there was no public participation, transparency, or parliamentary approval, which overrides our constitutional safeguards. They also raise issues of risks to data privacy and sovereignty, the key argument being that once our biological data leaves Kenya, there is no control over it. There are also legitimate fears of data colonialism and the misuse of critical information. Now, on December 11th, 2025, Justice Bahati Mwamunye issued a conservatory order to suspend the deal's implementation, specifically restraining the government from any transfer, sharing, or dissemination of medical or sensitive personal health data pending the determination of the case. The court has directed the government to file its response by mid-January 2026, and the matter is scheduled for mention on February 12th, 2026 to confirm compliance with the interim orders and then set a date for hearing. These events draw disturbing parallels to the Bill Gates fiasco in 2024, whereby Kenya's executive had granted the Bill and Melinda Gates Foundation and its staff diplomatic immunity, meaning that the foundation could not be prosecuted in criminal or civil cases. They were also exempt from direct taxation on salaries and other benefits. Now, in November 2024, Kenya's High Court suspended these immunities due to a lawsuit by the Law Society of Kenya, which argued that the foundation didn't qualify for diplomatic immunity. In April 2025, the Gates Foundation and Kenya's Foreign Ministry mutually agreed to end the agreement, with the foundation reverting to standard NGO operations. Now, old rumors of the Bill and Melinda Gates Foundation tampering with vaccines, among other allegations, still linger, eroding faith in foreign health deals. Furthermore, there are concerns that the United States government might be unable to meet its financial obligations in the deal. In an article by NPR, Fred Muhumuza, the director of Economics Forum at Makerere University in Kampala, Uganda, says that in the 1980s, the US used to fund countries through bilateral agreements, like what we are seeing today, and that they did not always meet their financial obligations. Furthermore, there are concerns that the project may face opposition from Congress in terms of funding, as it is purely an initiative of the American executive. The Kenyan side is not free of controversy either. The Social Health Authority, or SHA, which is meant to deliver universal health coverage, is marred in scandals, with billions in fraudulent claims, blocked facilities suspended, and unpaid bills piling up. This raises questions on whether or not the grant disbursed in the US-Kenya deal will be used for the intended purposes or whether it will find its way into individual pockets. Okay, so for the pros and cons for Kenya, the pros, number one, the huge cash injection for clinics, drugs, and medical training could accelerate universal health coverage and alleviate the suffering caused by the withdrawal of USAID. Secondly, co-financing whereby Kenya is required to provide $850 million for the project encourages domestic investment and may gradually reduce aid dependency. Thirdly, the partnerships formed may enhance outbreak response. For the cons, first, there are sovereignty and privacy risks as discussed, whereby data sharing could expose sensitive information without adequate protections, risking biopiracy. Secondly, corruption. Recent SHA scandals suggest that the funds may not reach the intended purposes, enabling a cash grab by officials. Thirdly, the United States will gain disproportionate access and surveillance on our health records. So, is this deal a lifeline for Kenya's health system, or is it a sophisticated data grab by the states, with opportunities for cash grabs by cartels and government officials? Now, the truth is nuanced. There may be real aid potential, but there will be serious trade-offs in a world where health is big business and a tool for control. The court's full hearing on the deal in 2026 could potentially change everything. So, what do you think about the deal? Do drop your thoughts in the comments and we will engage. Until next time, guys.